Good morning. I'm Joseph Peretta, an MPH candidate at the University of New England. Today, I am here to propose something that has never been done before. The first cross-cohort study to examine environmental links between Alzheimer's disease and autism spectrum disorder using statistical adjustments necessary to analyze associations across distinct physiological cohorts. While other studies have looked at environmental factors in both conditions separately, none have used the specialized methodology required to validly compare across these different populations. Imagine if we could identify environmental factors that contribute to both conditions and develop prevention strategies to protect both our aging parents and our children. Let me start with the staggering scope of these conditions. 7.2 million Americans are currently living with Alzheimer's disease. These are primarily adults aged 65 and older, though early onset cases can begin at age 40. Additionally, 1 in 31 children, that's over 3%, are now diagnosed with autism spectrum disorder. While these diagnoses occur in early childhood, autism requires lifelong support, meaning these children will become the adults of tomorrow, needing continued services. The combined economic burden is extraordinary, $1.24 trillion annually. This breaks down to 781 billion dollars for dementia care in older adults, plus 461 billion dollars for autism support across entire lifespans, from childhood diagnosis through adult services. To put this in perspective, this exceeds the GDP of most countries and represents about two-thirds of this year's national defense budget. But here's what's most alarming. Both conditions are rapidly increasing, and we may be missing a critical connection. So, if both conditions may share environmental triggers, surely there is extensive research connecting them, right? Actually, no. Despite mounting evidence that air pollution affects both conditions, no studies have examined these environmental factors across both neurological conditions within a single research framework. Research exists in isolation, separate studies for Alzheimer's, separate studies for autism. This creates a critical gap. We are missing opportunities to identify shared prevention pathways, and families affected by both conditions lack unified guidance. As the National Task Group on Intellectual Disability states, and I quote, studies are lacking that show a pervasive association with lifelong ASD leading to dementia. This represents a fundamental oversight in environmental health research. Why should this research be a funding priority? First, it focuses on prevention. Every foundation wants to fund research that prevents disease rather than just treating it after onset. Second, many families face both conditions, a grandparent with dementia and a grandchild with autism. Yet current research treats these as completely separate problems. The economic benefits are enormous. Prevention is always more cost effective than treatment. And since air pollution affects entire populations, this research has massive scalability potential. We are not just studying individual patients, we are examining environmental factors that could impact millions of people across their lifespan. Let me share how my background led me to identify this critical gap. I have extensive experience working with neurodiverse individuals over 3 years as a substitute teacher, which sparked my passion for autism research. On the other side of the neurological spectrum, my family's experience with Alzheimer's disease added urgency to understanding dementia prevention. My academic background in animal health provided a unique foundation most MPH students do not have. Comparative vertebrate anatomy and biology coursework gave me insights into embryological development and biological systems across the lifespan. This led me to study how exercise during pregnancy affects stress hormones, but research limitations forced me to focus only on cortisol's immediate effects. However, this limitation created my breakthrough insight. If hormones during pregnancy affect brain development, and environmental pollutants affect brain development throughout life, then we need to study environmental factors across the entire lifespan. This interdisciplinary background revealed the methodological gap everyone else was missing. This research isn't just academic for me, it is personal. This is not just one study. It is a comprehensive research program with three integrated phases that provide both immediate community benefit and long-term scientific analysis. Phase 1 is our quantitative foundation, a double retrospective cohort study using EPA air quality data and CDC health surveillance data. We will analyze exposure by geographic corridors to identify which specific areas show the strongest association between air pollution and both conditions. This gives us our evidence base and identifies the highest risk communities. Phase 2 integrates qualitative research through targeted focus groups. Critically, we recruit participants from the exact geographic areas that Phase 1 identifies as having the strongest pollution diagnosis associations. This ensures we are hearing from the families most affected by these environmental factors. Phase 3 is our standalone community-based participatory research. This operates independently in areas we already know have high pollution levels. We work directly with individuals who have these neurological conditions to assess severity levels and co-develop exposure reduction strategies. This provides immediate benefits to communities while we are still analyzing the broader data. Notice how this design provides immediate community impact while building the scientific foundation for nationwide prevention strategy. The expected impact operates at multiple levels. Our novel methodology will be the first to use statistical adjustments necessary for analyzing associations across distinct physiological cohorts. We will identify highest risk communities for immediate targeted interventions. Our community-based work will provide direct, measurable exposure reduction in high pollution areas. The policy impact includes evidence-based air quality recommendations, and we will create a scalable framework that other communities can adopt nationwide. This research will provide immediate community benefits while building the scientific foundation for population-level prevention. Research is only valuable if it reaches decision makers and affects the communities. Our comprehensive dissemination strategy targets multiple audiences. We will publish in high-impact epidemiological journals and provide policy briefings to the EPA, CDC, and state health departments. We will work directly with healthcare providers, pediatricians, neurologists, and family physicians to translate findings into clinical practice. Most importantly, we will engage directly with affected communities through the Alzheimer's Association, Autism Society, and patient advocacy groups. Results will reach decision makers, healthcare providers, and affected families through multiple channels simultaneously. Every year we delay this research, more children develop autism and more adults develop dementia from potentially preventable environmental causes. Your investment does not just fund research, it funds hope for millions of families and could identify prevention strategies through a novel cross-cohort analysis that saves both lives and the trillion-dollar annual burden these conditions create. For less than 0.1% of the annual cost burden, you could fund methodological, groundbreaking research that changes how we analyze environmental factors across neurological conditions forever. Supporting research citations are provided here. I am happy to answer any questions about methodology, timeline, or expected outcomes. Thank you for your consideration of this critical research.